Profit organization Health Justice Initiative is calling for transparency in the procurement of COVID-19 vaccines. The group was in court earlier today seeking to compel the Health Minister, Dr. Joe Phaahla, to hand over contracts, agreements and all COVID-19 vaccine negotiation meetings records. Fatima Hassan is a director of the Health Justice Initiative and joins us now to discuss this a little bit further. Salam, Fatima. Thank you for joining us on this afternoon here on eNCA. So what are you actually looking for, and why do you believe it's important to have access to these records?
Thanks, Dan. So what we're looking for is copies of all of the different contracts that government entered into with vaccine manufacturers and others during the COVID pandemic for vaccines. The reason why we are really interested in having access to these contracts is because it contains terms and conditions that would spell out what the pharmaceutical companies actually demanded from our government, what price we paid for each vaccine, what the details and provisions were around the sale of vaccines, donation of vaccines, export restrictions. So there's a number of elements that are contained in these agreements and these contracts that the public has not been able to see as yet, because they are subject to what's called non-disclosure agreements, and they've been regarded as a secret. And we believe, as the Health Justice Initiative, that this type of secrecy is very dangerous, both during times of a pandemic and even outside of the pandemic for future health procurement, that there should be total transparency, because we've used public funds to buy these vaccines in, considerable amounts of public funds. Some estimates are over 20 billion rands. So we believe that there's a public interest and also a constitutional duty on the state to actually open the contracts. And judgment's now been reserved. We've had argument this morning, as you've mentioned, and we will await the court's judgment in this respect.
Do you suspect that government could have overpaid for the vaccines?
So we believe that in certain instances, we definitely overpaid. There are some earlier media reports that indicate that, at least in the case of Johnson & Johnson, as well as the AstraZeneca serum vaccine, and potentially even the Pfizer vaccine, that we may have paid more than countries in the global north. But you'll remember that these contracts were negotiated globally at a time with so much secrecy and so much demands for non-disclosure. And the reason we believe that the companies insisted on this type of secrecy was that countries couldn't compare what they were actually paying for the vaccine. So based on media reports alone and preliminary media reports in 2021 and 2022, we are concerned that we may have actually paid an inflated price.
So do you believe then, Fatima, as the Health Justice Initiative, that transparency that you are calling for would assist in making government stop being, let's call them, partners in this secrecy with drug makers? You've mentioned some of the companies that made these COVID-19 vaccines, because if they carry on like this, how then do you regulate prices in a way that doesn't drive them too much high?
Absolutely, Dan. And, one of the other disturbing issues that arose in this proceedings was that government, as well as the pharmaceutical companies and the different entities, were refusing to give us the details of the legal entities that signed the contracts, which means that the public is at a disadvantage in terms of holding both these companies and our government accountable if we don't know who they've entered into the contracts with in the first place, and then secondly, what the terms and conditions were. So government, yes, we believe, was bullied into signing many of these agreements, but we don't believe that that is a justifiable defense to keeping the contract secret in 2023. They really should be opened up.
Do you have examples elsewhere in the world where there has been such transparency? Because my understanding is that even in Europe there's been such secrecy.
Yes, you're right. Unfortunately, we are in a situation where the vaccine manufacturers globally demanded such high levels of secrecy. Transparency International's own reporting and research indicate that globally less than 10% of the vaccine contracts that were signed during the COVID pandemic have been opened. So there isn't great levels of transparency in all regions of the world. There have been attempts by activists in other countries also using, like us, access to information laws to be able to access these contracts. Some of those matters are still pending, and in some cases they were only able to obtain a redacted version of the contract. Now, we believe, when we talked earlier about the terms and conditions outside of the issue of price, that there's also language that may have allowed companies to run roughshod over the sovereignty of nations such as South Africa. And that would explain why in certain instances, companies like Johnson & Johnson were allowed to send vaccines filled in South Africa when we were really desperate and waiting for them to customers in Europe, because they prevented the South African government from insisting on export restrictions that the EU and the US government used, but countries in the global south were not allowed to use. And the net result of all of the secrecy and lack of transparency globally and in South Africa is that global south countries were bullied into agreeing to far-reaching provisions, and also, we believe, paying different and inflated prices for the same vaccines.
Yeah, because if the prices were not inflated, access to vaccines will be much better. As we conclude, Fatima, you've presented your case in court today. You've made your arguments there. And how confident are you that those arguments will convince the court to rule in your favor? And just remind us once again as well, what's the next step in this legal process you have undertaken?
So unfortunately, I can't tell you how confident I am or not confident. We'll await the decision and the judgment of the court.
Why is that?
That could take a few.
Why is that?
It just, as a lawyer, that's one of the first principles, is the matter is now before the court. We hope that the judge will rule in our favor, but we can't speculate on what he will decide. That judgment will be handed down in a matter of weeks or in a matter of months. We're not sure, but we do know it will be a written judgment, and then we'll take the matter from there.
Okay, and if it's not in your favor, can we assume that you might take this matter further on appeal?
Definitely.
Thank you very much.
It's of such grave public importance that, I think it behoves us to actually take it up to the highest levels if need be.
Yeah, we hope to talk to you again once that judgment has been made to see what will be the next steps. Hopefully, it will be in your favor, because I would agree, and many people would, that we need more transparency around these contracts with the drug companies, especially with vaccines, because scientists are still warning us that we could face another pandemic or another virus of sorts that could affect the whole world. Thank you very much, Fatima Hassan. She's, of course, from the non-profit organization Health Justice Initiative. Still